So in this video, we're going to tie together a few topics that I've already discussed. We're going to talk about pattern movement, we'll talk about variability, and we'll talk about why position matters. And we'll use anterior knee pain as an example, and oftentimes it's called patellofemoral pain, which I think is totally unfair to the patella. It's kind of like an anatomist was throwing darts at an anatomy dartboard, and it hit the patella, and since the patella is in the front of the knee, it gets blamed for a lot of things. Blaming the patella for knee tracking problems or whatever we may assume is the cause of pain is like blaming a train for taking a wrong turn. The train can't make a wrong turn, it follows the track. The patella is no different. If I alter the track, I'm going to change the position of the patella. So let's focus on changing the position of the track versus the patella. If I'm patterned in my movements through stress or repeated activities, I will alter the track. And if I lose variability in the knee, the inability to change the position enough, then I can put stress on certain areas and I won't be able to alleviate that stress, and the brain may perceive this as a reason for me to have pain. It doesn't mean that there's damage, it just means that I can't alleviate the stress on the knee. Hendershite showed this in the early 2000s with runners. They looked at runners with unilateral knee pain, and on the invariant side is typically where they would have pain, and on the other side where they had reasonable variability, they had no pain. The cool thing about this study was as they restored variability to the affected knee, the symptoms went away. Now, I'm willing to be wrong here, but I would imagine that's why we always see things like VMO weakness associated with patellofemoral symptoms, because what we're doing is we're ending up with pattern behavior at the knee, and that's going to keep our destabilizing muscles like the quads at a specific length where they can't produce normal force. If they can't produce normal force, then what are they going to do? They're going to atrophy. So to sum things up, variability allows adaptability. So how you measure that and how you treat it is entirely up to you, but I think it's worth consideration.